The chief complaint for this patient is abdominal pain. MG is a 3-year-old female with a 4-day history of fever, nasal congestion, cough, and decreased activity level. Mom decided to seek care this morning in the emergency room because of the patient's high fever, new abdominal pain, and new vomiting. She's had a fever on and off since Sunday with a Tmax of 103.1, and Mom has been giving Motrin on and off since Sunday, which has been helping with the fever. She last received Motrin about an hour ago here in the emergency room. Today she presents with diffuse abdominal pain, diarrhea ×2 today, and 1 episode of non-bloody, non-bilious vomiting. She's had decreased solid food intake over the last 4 days, but is drinking well and has had good urine output according to Mom. She did have a sick contact, an uncle who was positive with a flu diagnosis, and was recently in the emergency room 2 weeks ago for similar symptoms, the fever and abdominal pain, and was sent home with a medication for gas pains according to Mom. For her past medical history, she was born full term, otherwise no medical issues. She takes no medications, she has no allergies, and her immunizations are up to date, but Mother declined the flu shot this year. She has a primary care provider at the Lawndale Christian Center and lives at home with her mom, dad, has no siblings, and does not attend daycare. Her vitals this morning included a temp of 101.2, a respiratory rate of 24, her heart rate was 144, oxygen saturation was 99% on room air, and her weight is 14.2 kilos. On my exam, she's an ill-appearing child, but interactive, cooperative, no acute distress, normal cephalic. Her right and left TMs were without erythema or bulging. She had a little bit of dried nasal drainage around her nose, but her throat was without erythema or exudates, and she has moist mucous membranes with no lymphadenopathy. Her lungs were clear with just some mild upper airway congestion, but no increased work of breathing. She had a regular rate and rhythm with normal S1 and S2, good pulses, and brisk cap refill throughout. From a neural perspective, she had no focal deficits. She was interactive and appropriate. Her abdomen was soft, non-tender, non-distended. She had good bowel sounds, no point tenderness, guarding, or rebound tenderness on palpation. And she was moving all over her extremities well. Her current problem list includes health maintenance, fever, vomiting, diarrhea, malaise, abdominal pain, nasal congestion, and cough. My assessment is a 3-year-old female with no past medical history who has a 4-day history of fever, nasal congestion, and lethargy, today with new abdominal pain, diarrhea, and vomiting. Her symptoms are likely secondary to a viral illness. High on our differential is influenza, given her contact with an uncle who had a positive flu diagnosis recently. Other possibilities include a viral URI, gastroenteritis, also gastroenteritis given her diarrhea and vomiting, Group A strep pharyngitis, but this is unlikely given her age and absence of erythema or exudates in her pharynx. And lastly, a urinary tract infection, given the patient's prolonged complaints of abdominal pain previously and now, and the presence of a fever. For our plan, it's just supportive care, encourage good fluid intake with Pedialyte and or water. We'll send her home with a prescription of ibuprofen to be given every 6 hours, 10 milligrams per kilo. Here in the emergency room, we'll do a PO challenge to make sure she's able to keep fluids down, and if she passes the PO challenge, she can be discharged from the emergency room. Currently, we find no reason to test for influenza because the patient's symptoms have lasted longer than 4 days, lasted longer than 2 days, and therefore we would not prescribe Tamiflu even if she did have a positive flu swab. And then we'll tell the parents that if she continues to have abdominal pain in the next few days, encourage her caregiver to take her to her primary care provider to test her for a possible UTI. And we have no consults necessary at this time.